Dear participants, I'm from Ukraine and represent the TBEC Europe Coalition, a civil society organization united Europe and Central Asia. Today, thousands of people stand behind us, hoping that all the stories we hear about negative experience with access to care, treatment, and its consequences will not be repeated. And in order for such stories, like we heard from TB survivors, which break lives and families, not to be repeated, governments should be accountable for their promises they make for their people. We don't want another fancy document, but a document that will hold countries committed and accountable. Accountability is not only part of a control mechanism, but is also a mechanism for bringing different sectors to collaborate together. And therefore, we ask for strong political declaration points that ensure national accountability, which are linked to a key asks and to key ask 6 and include translation of UNHLM global targets and commitments into a national level targets adopted by country within the national frameworks and legislation. Multi-sectoral collaboration and accountability mechanisms should be implemented at countries aligned with One Health approach. Together with annual country reporting and cross-sectoral high-level periodic reviews of achieved progress. We all know that TB is to a great extent driven by social determinants of health. In challenging environments such as war in Ukraine, all social and economic factors that contribute to the development and spread of TB become even more acute. Equitable access to healthcare services is important for TB prevention and successful treatment, and this cannot be achieved solely by the efforts of the healthcare system. We really need political will. High-level commitment and sufficient funding are necessary to mobilize the work of different sectors at different levels. Last but not the least, civil society and communities should be meaningfully engaged in TB response, fully funded and recognized as equal partners in decision-making, implementation, monitoring, and reporting. Thank you.